We are back here on the Lynne Hayes Freeland Show. My guest today is Dr. Stephen Evans, and we are spending this entire show talking about breast cancer awareness, the African American community, things you need to do, things you need to keep in mind. And I want to just circle back because just before the break, Dr. Evans, you mentioned a male patient. And I think it's hard enough for us as women sometimes to be forthcoming about our health struggles, and in this case, breast cancer. I can only even imagine how much more difficult it would be for an African American male to say out loud, I have breast cancer. We got to get away from that.
Absolutely. And more importantly, it further challenges us in other ways. Because of that experience with my current patient, it challenged us to relook at our signage in our imaging center and the pictures. And because with the men going into an environment that is primarily geared toward women, it can be off-putting. And so we have to be careful about being inclusive in our messaging and how we communicate in a sensitive fashion to men who are being diagnosed at this time as well.
Yeah, that's absolutely a good point for me. Here on in, I'm going to make sure when I talk about breast cancer awareness, it is not gender specific.
Please.
So I also want to go back because we talked a little bit about outcomes and how women of color, we can have different outcomes. Is when we are diagnosed, does that play a role in this at all or not so much?
Well, we're really not sure of the full answer to that question. And that's why it's important to study that. And that's the importance of clinical trials. Just imagine, here at the University of Pittsburgh Hillman Cancer Center, we have the greatest scientists. We now have recently joining us again, Dr. Norman Walmart, who oversees the NSABP. Imagine he and the late Dr. Bernie Fisher, they changed how we treat women with breast cancer. We formerly performed breast cancer surgery with Halsted modified radical mastectomies, and only through their research and study did we realize that we can perform breast conservation surgery and still have similar outcomes. And through his scientific research, we know that we can add hormonal therapies to women's treatment regimen so that they too can have preventative and protective treatments along their journey to help them live longer lives and reduce the risk of recurrence. That all comes about through research. And few African American women or men participate in our research and clinical trials.
That's probably a show unto itself, but
Yes.
You open that door, so now I'm going to walk through it, because so often in our community, we will use, well, you know what happened in Tuskegee, you know what happened with the Tuskegee experiment, but I'm also amazed sometimes because the people who say that to me often weren't even born when the Tuskegee incident happened. And do you think that still is a prevalent influence on whether or not we sign up for trials and participate in them?
Well, let's look at that. This season of a pandemic, Lynn, has raised our sensitivities to the issues of racism that's part of our culture and our country. And we can no longer just not speak to that past. In order to get beyond the pain of that past, we have to confront it and move forward. Yes, it did happen, but now our clinical trials, be confident that if you are engaged in a clinical trial here at our system, that you are getting not only the best and the standard of care, but we're looking at adding another additional agent to see if that can improve outcomes even beyond what they already are. So being in a clinical trial should be really embraced as something very positive.
Well, I also think sometimes when we talk about clinical trials and we talk about African Americans, the realities are if we're not involved in the trial process, then we don't know if our outcomes are going to be the same. Correct?
That is correct. And to help with even that language and communication, we've engaged patient navigators, women of color, to help women bridge that cultural divide and feel more comfortable having the conversations about what research really means. And so they can have that conversation in culturally confident fashion, so that the conversation becomes normalized.
Okay. Okay. So then, and I'm going to, you know what, let's do this. I'm going to take a commercial break. Then I want to come back because I know that, well, I'll talk to you in the commercial break. We'll take a break. We'll be right back when the Lynne Hayes Freeland Show continues.